In this presentation, we shall discuss the eye examination. An accurate history must be obtained before starting the physical examination. Let's demonstrate the steps in eye examination. Visual acuity testing is the first step of eye examination in all patients. The only exception is the patient with chemical burn, who requires urgent irrigation.
Measure the visual acuity for each eye. Use a pinhole if acuity is worse than 20/30 equaling 0.7. Perform a confrontation field test for each eye. Test the extraocular movements. Inspect the lids and the surrounding tissues. Inspect the conjunctiva and sclera. Test the pupils for direct and consensual responses. Assess the anterior chamber for depth and clarity. Inspect the cornea and iris. Access the lenses for clarity through direct ophthalmoscopy. Use the ophthalmoscope to study the fundus, including the disc, vessels, and macula. The Amsler grid test is intended to reveal any abnormalities in the central area of the visual field. Have the patient hold a white on black test card, approximately 16 inches away from them, with one hand covering one eye with their other hand an occluder or a patch. Direct the patient to stare at the center dot and to report if any portions of the grid are blurred, distorted, or absent. The patient should not move their gaze from the center dot so that the presence of any distortion can be assessed. If visual disturbances are noted, the patient is a likely candidate for further studies.
Reduced visual acuity is the best single criteria by which to differentiate potentially blinding conditions from less severe ocular disorders.